So thank you very much, Deputy St Pierre. So, as Deputy St Pierre said, we're in a really good place. We reached a milestone when our first test run came off this morning, our first run of tests, and that we've now done over 4,000 tests in the bailiwick. So really, really impressive from that point of view. We remain at no new positives on day 15 of no new positives. We have 252 cases, so that's remained stable. And we now have only 7 active cases. So everything moving in the right direction for us. So I think from that point of view, it's really positive. What we're seeing in the community is we're not seeing very many cases of respiratory type illnesses, loss of smell, loss of taste, so we've got very little activity in the community. So what we've actually done is moved forward some of our expanded testing program. So we're starting now to test asymptomatic people working in key areas. So that's been important as well. So we're moving away from testing of symptomatics only to some asymptomatic testing as well. And that, of course, relates to the direct detection of the virus, so our PCR-based assay. So we're very pleased with the progress of that, which brings me into antibody testing. And I've had quite a few questions about antibody testing. And I think you all know that I favour the well-based assay, so the one that we can do 96 tests at a time. You may have read that the UK have procured antibody testing through a certain provider. Guernsey is going to be getting tests from the same provider. It's been a test that's been rigorously evaluated by Public Health England, and we've put in an order for 10,000 of those tests for the bailiwick. So we'll be looking at using those. As I've said to you before, we're not intending at this stage to do large-scale population-based seroprevalence because we think the incidence of infection in the island is very low. What we're doing is looking at testing certain targeted groups. So, for example, sometimes, as I've said to you before, when someone has COVID-19, they can get rid of the virus very quickly. And indeed, some of the later symptoms can be mediated by the body's own immune response to the virus. So they've lost the virus, but the body's immune system is causing some of their symptoms. In those cases, you might well see the people being antibody positive. So it'll give us an additional diagnostic tool. It's not common. We've got a handful of cases who fall into that category, but it would be nice to test such individuals. So that's the main group. The other group that we're going to look at are the contacts of known positive cases. So we're going to offer them testing as well to see if there was any asymptomatic transmissions in those groups. So very, very targeted groups. So that's with regard to the antibody testing. So the other thing I wanted to comment on is the progress to phase 3. Now, we always said that our progress and our exit would be driven by evidence, good evidence and bad evidence. What we have seen today with our progress and our recommendation from a public health perspective that we moved to phase 3, we've seen that we've actually exceeded our expectations. So if you recall, progressing from phase 2 to phase 3 meant that we had to have stable or decreasing levels of community-acquired COVID-19 infections. Actually, when we look at the data we have now, our last case of unexplained community transmission of SARS-CoV-2 occurred on the 21st of April, and we moved into phase 2 on the 25th of April. Since then, we've had no cases and no cases of community-acquired transmission. So we've exceeded our expectations in that way. Other parameters for progression were access to on-island testing. Our on-island testing is functioning very well. We have enough reagents to not only test our symptomatic people, but to extend into some asymptomatic testing as well. We've had high degrees of community compliance with all of our messaging, so that Guernsey Together brand, if we want, for want of a better word, has worked so well for us. And Dr. Raby will tell you the hospital is quiet, and linking with our GP colleagues, there's no untoward activity that we're aware of in the community. So we're in a far better place than we thought we'd be, which is why it was only right to recommend, because we're in a better place, that we actually progress sooner. So we always said we would only keep measures in place for as long as we had evidence, and I think you all know how much I love evidence, as long as we had evidence to keep those measures in place, and we've really exceeded those expectations. So the final thing I wanted to comment on was elimination. And I think here you need to differentiate between elimination and eradication. So eradication is when you permanently reduce to zero a particular infectious agent globally. Okay, so if you ask me for an example of a infection that we've eradicated globally, that of course is smallpox. So it no longer exists across the whole world. Elimination is a more narrow definition. So elimination is when you reduce to zero an infection in a particular geographical region. So we're considering the bailiwick as our geographical region. An example of a virus that we've eliminated locally, but they haven't eliminated in the UK, is measles. So those are examples for that. So that took us in the Public Health Department, and we had a wonderful couple of hours trying to define how we would look at elimination. How would we say that we've eliminated the virus that causes COVID-19? So there isn't an international definition that we could find, or a reliable one. So that took us back to first principles. And we could say, well, we've had no new cases for 15 days. Should that count? We'd argue not, because as you would see from our data, we've still got 7 active cases. So although those 7 active cases are still in quarantine, there are still people who are potentially excreting the virus on the island. So what we're thinking of doing, and we've opened this up for academic debate with various of our colleagues in the UK, is what if we looked at the last active case disappearing and look at, say, a cycle of 28 days after that? Is that a definition we could work with? So we're throwing these ideas up for discussion in the academic communities. How do we actually define elimination of the virus that causes COVID-19? What is important for us is that we actually do exit testing. So when someone is diagnosed as being positive, we don't release them from quarantine until we've tested them and showed that they no longer have the virus. Now, that's different in different jurisdictions. A lot of people aren't doing that exit testing. So we're quite confident we can do the exit testing and then work on some sort of definition of elimination. So that's going to be an interesting one, and a debate that we want to have both within Guernsey, within the whole bailiwick, but across various places in the world as to how do we collectively here and globally define local elimination of the virus that causes COVID-19. So thank you, that's all I've got.
Thank you.